good to go.
Hello, my name is Dakide Margaret. I'm an epidemiologist and I'm based in Bale Regional Referral Hospital. So today I'll be talking briefly about malaria, given that it's one of the diseases that are very prevalent in our region. And Bukedi region is one of the areas with a high prevalence of malaria. And the children are mainly at risk of this disease. Malaria is spread by female Anopheles mosquito, and it attacks the red blood cells. So it's very important for us to always sleep under an insecticide treated mosquito net, because we reduce contact with mosquitoes. And then it's important for us to clear the bushes around our homes. Please ensure that you dispose of the waste properly, especially the empty bottles, the containers, the buveras. Avoid stagnant water around your homes. And we know some of our areas are rice growing areas, and during those rice or harvesting and planting seasons, we see a spike or a hike in the cases of malaria. So during that season, we can also use mosquito repellents. They are advisable, they are good. I don't know for the Mutua ones whether they can access them, but it's one of the preventive measures. And then in addition to that, close the doors early. Have wire meshes in your houses. If possible, install. Why? Prevention is better than cure. The wire mesh you buy, it will last a long time, and that money you would have used for hospital, at least you save it and use it to buy food and other basic needs. So when the babies are affected by malaria, avoid self-medication. When you realize that your child has a high temperature, please seek medical advice. Otherwise, sometimes people take in medication which actually does not help them. It instead worsens the condition of the person. Why? It may not be the appropriate medicine that you're giving to the child. And if you give the wrong medication, you end up like the person is not getting well, and by the time you realize that you can't actually manage the condition yourself, it's too late. You bring the child to hospital when they are already very anemic, and the doctors cannot do much at that point in time because the immune system is already weakened. And maybe just to bring you to speed, there is it's been observed. I've been doing a mortality surveillance, and for most of the children that die at hospital, they come in late. Sometimes blood is out of stock, and if they cannot get the blood, then they die. They die in less than 6 hours on arrival to the health facilities. So I advise parents, please take children, at least don't start treatment without a diagnosis. Sometimes we pretend we are doctors. When you see that someone has fever, you're like, this is malaria. So you hurry to the clinic, you pick antimalarials, sometimes you're even just taking a painkiller. Don't you see you're not helping the child? So in that case, I advise that you seek medical care and make sure you get a proper diagnosis, because if you misdiagnose, you're treating a wrong condition and you're going to give the wrong treatment. So diagnosis is key. And to boost our children's immunity, let us feed them well. Let us boost at least their iron levels, because we see that anemia is an underlying cause of malaria deaths. Most of those children that pass on when they have malaria are actually anemic at the end of the day, because the malaria parasites attack the red blood cells, which transport oxygen. So let us be vigilant. A balanced diet and a well boosted immunity are what actually help us to fight off not just malaria but all infections. When an infection comes and you are well prepared, you have your soldiers, those are the antibodies, very active and a very vibrant immune system, then you fight off all the infections. So let's feed well, let's have a well protected environment, and let's do diagnosis before giving treatment. That is it for now.